Hey guys, welcome to another lesson of Pharmacy Tech Study Guide. This is your pharmacist Sidra, here to help you and guide you through the process of becoming an excellent pharmacy technician. In this video, I will be talking about 7 different kinds of pharmacies. We will be discussing various types of pharmacies that exist and the different roles that they play in the healthcare industry. Alright, so first let's start with community pharmacies that you can see everywhere. These are the pharmacies that you typically see in your neighborhood or in your local drugstore like your Walmart, CVS, Walgreens. Community pharmacies dispense prescription medications to patients, and they often provide other healthcare services like vaccination, blood pressure checks. Lately, community pharmacies have started doing COVID testing. They also do other healthcare testings. Now, these are the part of the healthcare system that provide convenient access to medications and other healthcare services for patients in their local areas. Patients can literally call and speak to the pharmacist because pharmacists are easily accessible here. Just like a call away, they can get over-the-counter medication recommendation from them. Also, the pharmacist can educate the patients about any of their medications, any medication interactions, they can give them suggestions about their over-the-counter minor problems or injuries. So basically, this is the kind of pharmacy setting where the pharmacists have direct connection and one-on-one interaction with the customer. We dispense the medications to the patients, and we also take care of their insurance needs. While when we talk about the hospital pharmacies, which is the next type of pharmacy I want to discuss. In hospital pharmacies, they don't really talk about the insurance aspect for the patient. It's an inpatient pharmacy. In hospital pharmacy, the pharmacists don't really interact with the patients. They interact with the doctors and nurses, and they're responsible for dispensing more like a high dose kind of medications. In terms of like high dose, what I mean by that is more like IV medications or other serious compounding medications which are required for intensive care patients or patients who are critically ill within the hospital. Now, hospital pharmacists, they work, or the hospital technicians, in other words. In hospital pharmacies, the pharmacists and the technicians work closely with the doctors and nurses to ensure that patients receive the correct medications and correct doses at the bedside, right? They play a crucial role in the patient care as they ensure that the patient receive the medications that they need while they are in the hospital. In hospital pharmacies, the technicians have a little bit of different, or rather additional role, which retail pharmacy technicians don't have, and that's the Tech Check Tech program. In this program, technicians undergo necessary training and some tests that are taken by the hospital. And what happens is a technician checks the work of another technician under the overall supervision of the pharmacist. I have a detailed video on the Tech Check Tech program, which will kind of give you more detail about it, so check that out if you are curious to know more about this program. The next up, we have the specialty pharmacies. Now, these are another type of pharmacy setting. Rather, a retail pharmacy setting which provide a medication for specific diseases or conditions. It's not really open to general public. Specialty pharmacy doesn't dispense your common blood pressure medications or diabetes medication. These pharmacies dispense special medications such as your HIV medications, your hepatitis medications, and they're dealing with like a high dollar amount medications which require a lot of medical justification and fighting with the insurance to get it covered. And we're not talking about medications here which are maybe just a couple $100 or maybe even like a couple $1,000. We're talking about medications which are like $20,000, $30,000 and over. These are complex, medications, and they are for the patients who have complex medical needs or require specialized medications for treatment. In specialty pharmacies, specialty pharmacies can be found in a variety of settings, including hospitals, specialty pharmacies can be found in a variety of settings, including hospitals, clinics, and standalone pharmacies. Often, these big retail pharmacies have like a chain or a branch of these specialty pharmacies. Like for instance, with Walgreens, all the specialty prescriptions that we get at the retail pharmacy are not really processed at the store level. What happens is if we do receive a prescription which is, a specialty medication or should be coming from specialty pharmacy, it is processed in the system or received from the doctor's office in our system, and then from our system, specialty pharmacy will pull the prescription and work with the doctor and the patient and insurance to ensure that the medication is dispensed to the patient. And sometimes they don't even dispense the medication directly to the patient. They'll ship it to the other retail pharmacy, and from where the patient can pick up the medication. Now it's funny, and I think here's a fun fact. I would rather say that for a average retail pharmacy, they do somewhere between 200 to 600 prescriptions, depending on how busy the pharmacy or whatever the tier of the pharmacy is. But the specialty pharmacy does sometimes just like 10 prescriptions a day. And you may think that, oh, this is like an amazing job where you do only 10 prescriptions a day. But here's the thing, that processing those 10 prescriptions a day is literally hectic and as challenging as processing like 300-400 prescriptions a day in your average retail pharmacy, because it does require a lot of effort in terms of contacting the doctor's office and getting proper justification and diagnosis to get such an expensive medication covered on the insurance. And that's why at the end of the day, a regular retail pharmacy is probably doing like 200-300 prescriptions, is probably not making as much revenue as a specialty pharmacy is making by doing like maybe just 10 prescriptions a day. So if you as a technician ever get a chance to work at a specialized pharmacy or specialty pharmacy, definitely take that opportunity as a learning curve and something that you can use in your resume to kind of climb up your career path. All right, so next up we have the online pharmacies. Now these pharmacies are becoming very popular in the recent years, with everything being super fast, and we're just so spoiled these days that we want everything at the comfort of our home. We don't want to go out and do anything. And also with all these Optum Care pharmacies and Amazon pharmacies in place, these pharmacies are actually gaining a lot of popularities because you simply place an order with those pharmacies, and the pharmacies kind of realign your prescription medications, your maintenance medications, and they automatically fill them every month, and you receive the medication at your doorstep without even leaving your home. And patients can actually call their prescription orders ahead of time online, and and if the medication is not on automatic order, the patients can also manually call the pharmacy and or just place the order online. While being convenient, it's important to make sure that if you use an online pharmacy, it is legitimate and it follows proper regulations, because online pharmacies, sometimes you never know where the medication is coming from. It could be, you could be living in California and your medication or the pharmacy is in New York sometimes. I think one of the caveat of online pharmacies is that sometimes they don't really dispense or send you the controlled medications. And even if they do, then sometimes with the weather condition or delay in the delivery services or mail services, if the medication is not sent to the customer on time, then the customer is left kind of in a situation where they have to figure out how they can go to a local pharmacy and get like a short supply of the medication. And honestly, with controlled medications, it becomes even more difficult, because a lot of the retail pharmacies then don't want to really dispense those controlled medications ahead of time as a short supply while the patient is waiting for the prescription to be delivered. But one thing to remember is that if you do handle a situation like this where your patient is waiting, never ever tell your patient that, oh, you're gonna have to pay out of pocket because your insurance is not gonna pay for it, it's too soon, and so on and so forth. So what happens is, in that case, you can literally call the insurance company and tell them that the patient's medication is in transit and there is a delay in the delivery of the medication. And so the insurance company will provide you an override to put in the system so the medication can, so the patient can get the medication free of cost or within a reasonable copay, whatever the patient's insurance plan offer. But it is, I think, unethical to just have your patient pay for the medication straight up and not even offering the to call the insurance for the patient. And just something to keep in mind, that there is an extra work on your end as a pharmacy technician. Like, you have to do it for the patient. And I've seen that some of the pharmacy techs just don't want to go an extra mile, but that's the name of the game. If you are going an extra mile for your patient, that's only when you are truly fulfilling your job and providing that excellent customer care and patient service. Okay, next up are your compounding pharmacies. These are the pharmacies that specialize in creating customized medications for patients. These pharmacies work with doctors and patients to create personalized medications that meet the specific needs of the patient. Now, in compounding pharmacies, they make the medications that don't already exist in market in a pre-made form. Like, you cannot go to a compounding pharmacy and expect them to make a blood pressure medication like lisinopril 20 milligrams, which is already present in the market. No, they're gonna put together those medications which are not present in the market. And these can be great options for patients who need medications that are not readily available, or who have sensitivities or allergies, or sometimes who have allergies to, let's say, this is a great option if a patient has sensitivity or allergy to one of the inactive ingredients of the medications. And then because in the facility or in the factory or the manufacturing place where the medications are made, sometimes they use a big batch where sometimes they use a facility where multiple medications are made, and there is a chance of cross allergic reaction. So compounding pharmacy comes very handy in that case. Like if somebody is looking for like a gluten-free medication, or some looking for for a medication which doesn't has any peanuts in it or any milk products, or because the patient is lactose intolerant, something like that, then in that case the compounding pharmacy can put together the formula that is specific to the individual needs of the patient, and they don't create their own formula. They use the reference guides of the pharmaceutical industry, which is like United States Pharmacopoeia or other recipe guides in the pre-existing pharmacopoeias to make that or compound that medication. Then we have the long-term care pharmacies, which provide medications and other healthcare services to patients in the long-term care facilities, such as your nursing homes or assisted living pharmacy or assisted living facilities. These pharmacies work closely with the healthcare team to ensure that the residents in this assisted living receive the medication and support that they need to maintain their proper health and quality of life. Finally, I want to talk about the mail order pharmacies. These are pretty much similar to your online pharmacies. They provide medications and other healthcare products through the mail. And these pharmacies are often used by patients who take maintenance medications for chronic conditions and prefer to receive their medications on regular basis without having to visit to a pharmacy in person. Now, the difference in the mail order pharmacy and the online pharmacy is that the mail order pharmacy is only going to dispense the maintenance medications. It's not going to dispense any of your controls, any of your acute treatment medications like antibiotics and something like that. They're only going to dispense the regular maintenance medications. Alright, so that wraps up today's video. I hope this was helpful for you and it gave you a better understanding of what are different types of pharmacy settings, because when we think about the pharmacy settings, the only two settings that come to our mind are the hospital settings and the retail settings. But in the modern healthcare system, there is much more to offer in terms of different unique settings of pharmacies, and that also provide unique opportunities for job and career for pharmacy technicians. And if you are interested to know what are different career settings or career options for you as a pharmacy technician, then do check out my video of pharmacy technician's career, where I have kind of given you a good understanding of what settings you can work, different job duties of the pharmacy technician in all of these settings. And I guess another important thing that what is the another important thing is what are the wages ranges in all of these different settings. So I hope this was helpful for you. I tried to keep it short and sweet. If you have another lecture recommendation, do let me know in the comments and I'll try my best to put together an easy to understand lecture for you guys.